Hello there. Welcome to my show. COVID-19 update by Heerak for October 2nd, 2020. It's 6th-month anniversary show. As the Cubs states in front of you, 6 months down, a lifetime to go. But the lifetime is different for everyone. Some people live to be 100 years old. Some people live to be 80 years old. Some people live to be 60 years old. Some people live to be 40 years old. Some people live to be 20 years old. Some people die before reaching 18th birthday. So lifetime is different for every human being. And the quality of lifetime is different for every human being. Some people live 100 years and their quality of life may not be as good as someone who lived 30 years. So how long you live does not determine what the quality of your life was like. As you know, President Trump is the president of the United States of America. He's the leader of 330 million Americans. And he had done a lot. Let's be honest here. Whether you like Trump or dislike Trump, I like President Trump. You can't deny the fact that he has accomplished more than most people have accomplished in their entire lifetime. He has built a real estate empire. And President Trump basically started with nothing or little. He did have little help from his father, but who doesn't get help from their father, right? Not all fathers are at the same economic level, but fathers try to help their sons. So having a father who helps you is a normal thing, and fathers should help their children. But he didn't help President Trump that much. I mean, he built a multi-billion-dollar empire from nothing, basically. He went to Fordham University for a bachelor's degree and transferred to University of Pennsylvania as a Wharton School, which is one of the best, if not the best, business school in the world. And he excelled, and he used his knowledge to build an empire. There have been many graduates of Wharton Business School who have become billionaires from nothing. So there are others as well. But what sets President Trump apart from other business moguls or billionaires, self-made billionaires, is President Trump has done a lot of other things. He's versatile. He basically ran Miss USA contest, and those who won Miss USA went on to Miss Universe. And he has also been a TV star, a reality show about getting hired. He started like Trump University, and he's married a beautiful woman, like and he has children who support him. As you see, Eric Trump and Donald Trump Jr., they're fiercely loyal to their father. And that says a lot about a father, because not all sons are that way. And so you see that, President Trump has accomplished a lot in his personal life, in his relationships with his sons, and his activity. And he's not embroiled in all these controversies. Some billionaires get embroiled in a lot of controversies like sex trade and stupid things like that, or cocaine or drugs. So President Trump has led a fairly clean life, um, and he's been respectable in society ever since he left Wharton Business School, and he has been ambitious, and he has worked hard to get there. He works hard. He's a workaholic, type A personality. He's has Scottish roots, and so he's influenced heavily by Scottish Calvinism, and that's work ethic. So that Scottish Calvinist work ethic runs strong in President Trump. He was part of the Presbyterian Church in New York, and he's an active Christian. He believes in God, and he tries to live a life that is according to the Bible. There are a lot of Presbyterian pastors who've gone away from the Bible, not teaching what the Bible says, like in Romans 1, and that's unfortunate. Um, but as someone who's not a clergyman, President Trump has tried hard, and he has, led the March for Life, pro-life anti-abortion movement. He's the first president ever to march in March for Life, and Ronald Reagan even did not do that. So he's a hero to millions of Americans who are anti-abortion. And he sees eye to eye with Pope Francis regarding abortion. And Pope Francis considers abortion as a murder. So obviously, logically, anyone who commits abortion is a murderer in the eyes of Pope Francis and in the official position of the Catholic Church. As you know, the official position of the Catholic Church is not to give communion to any politician who votes to legalize abortion or maintain the legal status of abortion. And the assumption is that any politician who votes to maintain legal status of abortion will go to eternal damnation in hell, because if you're not allowed to take communion by official Catholic Church rules, and John Paul II emphasizes a lot, then you are going to eternal damnation in hell. And so officially, following this rule, we know, Ted Kennedy went to eternal damnation in hell because he did not change his position on abortion. So when Ted Kennedy wrote to the Vatican asking for prayers before his death, like extreme unction, they denied him that, because their position is that he's going to hell for his abortion positions. So abortion is a very serious issue in the Roman Catholic Church, and it is understood that those who support abortion go to hell. That's understood even in evangelical Protestant churches as well. President Trump is a hero to many pro-life movement individuals. And so, many people were shocked and devastated when President Trump announced yesterday night that he has COVID-19. He and his wife, Melania Trump. Unfortunately, COVID-19 is a virus that spreads aggressively. And it is mostly droplet, meaning, if you're within 6 feet of someone, you can get it just by them breathing on you or talking with you. But there are airborne dimensions to COVID-19, means there's scientific proof and evidence-based research that shows that COVID-19 particles can remain floating in air. So you can't even be 10 feet away and still get COVID. And Harvard University School of Public Policy and MIT emphasized this as early as March and April, that you could be like 16 feet away and still get COVID. MIT did a research, scientists did a research, and they announced their research in March and April. So the concept that there's an airborne dimension to COVID-19 has been around for a long time, since the very beginning of COVID-19 research. So obviously, healthcare experts do not deny that COVID-19 can be airborne, that in some strains, some instances. Obviously, they're still doing research to understand exactly when and where and how. But there is enough evidence to show that COVID-19 is airborne and can spread through the air, in which case a mask will not really protect you, except for N95 masks. And most people don't own an N95 mask. You can order N95 masks online through Amazon, but they're very expensive. One mask is like $20 or $30 or more sometimes. The price is fluctuating, so it may be cheaper now. But generally, you use them once and throw it away. So you need one per day minimum. So you need 365 of them minimum. So you can imagine, it's difficult to buy them, and sometimes they sell out, so you can't even order them because they protect you from airborne particles. But even if they're available, they're very expensive. So it's hard to purchase that if you are middle class. Certainly for use, daily use for 365 days a year. Um, yeah, it's looking bad, and that's why I work ceaselessly for 3 months in Virginia's 8th district. As you know, I'm running for U.S. Congress in Virginia's 8th district. I'm independent candidate for U.S. Congress. So I worked for 3 months ceaselessly to close down public schools in Arlington County, Alexandria City, Falls Church City, and Fairfax County. Part of Fairfax County is Virginia's 8th district. And I successfully convinced them that they need to shut down. Fairfax County was originally planning to open up in July and have several days per week classes in person. And I bombarded them with tweets and told them you need to shut down to save lives. Thankfully, they caved in and went 100% online. Unfortunately, Fairfax County public schools is now considering opening up again. Serious problem because Arlington County, which is where I live, is very close to Fairfax County. So if COVID-19 starts spreading exponentially in Fairfax County, it's going to come to Arlington County. So if that starts spiking in Fairfax County, that will spike in Arlington County. So I tweeted several tweets today, and you can go to my Twitter account, Heerak #4 Congress. And I tweeted directly to Fairfax County government that they need to shut down or keep Fairfax County schools closed. And I'm warning Fairfax County government, if they open up public schools, they're going to have tens of thousands of deaths. They're going to have thousands of more deaths. And Fairfax County was the epicenter of COVID-19 in April. And it promises to be the epicenter of COVID-19 this time as well, because a lot of people who work in DC live in Fairfax County. And so COVID-19 spreads from person to person. And so this flu season, which is 6 months long, we're expecting a lot of people to die in Virginia's 8th district. And we don't need to add to the number of deaths by opening up schools. As you know, Virginia Governor Northam and his wife, Pam Northam, got COVID by visiting Prince William County public schools that were open. And so we don't need that kind of proliferation of COVID-19. We're talking about Virginia Governor Northam and Pam Northam, who just walked around everywhere and they got COVID-19 from a school. You know why? Because a school building is confined and school classroom is small. You have low ceiling, you have 4 walls, it's contained. And as I said, COVID-19 is airborne. So certain particles in certain instances, certain cases, and scientists are doing research on it, but COVID-19 has airborne dimensions. So it's floating around. And even if you wear a mask, you still get it. If COVID-19 is airborne. And it is. Higher ceilings help. But if there have been kids in the classroom for a long time, there are a lot of particles running around. COVID particles if there are children who have COVID. Um, so it's much easier to get COVID in a small school setting. And as you know, I'm a public school teacher. I taught at Wakefield High School in Arlington County. I taught in District of Columbia Public Schools at Savoy Elementary School, fifth graders. So I know how small the classrooms are. And I know how children behave. You know, they move around and they may keep the mask on when you're looking, but, you know, they may take it off just to like play around, you know. They may not take COVID-19 that seriously, you know. Children are children. So opening up schools in Fairfax County will endanger thousands of lives in Arlington County. There's no question about it. It could raise death rate by thousands or tens of thousands or even more. Because one person can infect like 1,000 people. And every one of those 1,000 people who get infected can infect 1,000 each. And we have 6 months of flu season coming. So yes, we have 6 months down, but not many of you are going to make it to next 6 months. President Trump has COVID-19. Now what? Well, I have 3 recommendations for the US federal government and federal government agency. Number 1, you must prepare for the eventuality if President Trump dies. He's over 70 years old, he's overweight, and some say he has heart conditions. So he's vulnerable. Even if he doesn't have heart conditions, he's over 70 and he's overweight. So there's a chance that he can die. If you see old people who survive COVID-19, most of them are thin. Like their body mass index, BMI, is very low. Like they're not overweight at all. Those are the old people who've survived. There aren't too many cases of obese and morbidly obese old people who survived COVID-19. You know, when the cases become serious, and it often becomes serious with older people. So there's a very high chance that President Trump would die from this. Obviously, you know, I'm hoping that President Trump won't die. I like the guy. But obviously, you know, I don't deal with lies. I'm not the liberal media who tells you that President Trump has little chance of dying. Because liberal media has been lying to you all this time. I saw CNN, and there are people from CNN saying, oh, President Trump, there's a 95% chance President Trump will live. I think that Dr. Sanjay Gupta was saying that. That was like bull. You know, that's not true. President Trump's chance of survival is less than 50%. Because of his age, because of his overweightness. And he's showing mild symptoms, and he could accelerate quickly, and he could die within hours after symptoms become severe. So when Dr. Gupta says 95% chance of President Trump surviving, that's like completely nonsense. President Trump's chance of survival is less than 50%. Less than 50%. When United Kingdom Prime Minister Boris Johnson got COVID-19, he had no symptoms originally. It developed into mild symptoms, and then he was rushed to the hospital, and from a hospital unit, he was rushed to ICU. He barely survived. He could have died. And he's like 30 years younger than President Trump, or 20 years younger than President Trump. And his chance of dying was high. His chance of survival, Boris Johnson's chance of survival was less than 50% as well. And obviously, President Trump has far less chance of surviving than Boris Johnson, the Prime Minister of England. And I tweeted to Boris Johnson that he could get COVID-19 again this flu season, 6 months long, because World Health Organization said you could get COVID again. So did Center for Disease Control. Dr. Fauci has said that. Every healthcare expert says the antibody is not full immunity. It's not forever immunity. you can get COVID-19 again and die. So I tweeted that out to Prime Minister Boris Johnson, just to remind him to be careful. But yeah, I don't believe the fake media, because they try to make it sound like it's not serious. COVID-19 isn't serious. Like CNN is guilty of that. They try to make it seem like it's going to go away. And the liberal media, because they're lying to you, that's why so many people are getting COVID. I mean, we have like 1,000 people dying every day in the United States in the summer. And in the flu season, we could have 10,000, 20, 30,000 people die per day. I'm glad to see healthcare experts coming up around to my position, because that's very highly likely. And science proves that that can happen. There should be no reason why you should deny the possibility, because science proves that it can happen. I don't believe in the liberal media. CNN is not accurately portraying the seriousness of what President Trump is going through. And that's why my recommendation number one to federal agencies like National Security Council, Homeland Security, Federal Bureau of Investigations, and other federal agencies, that they need to go to code red, because anything can happen. If President Trump dies, the moment the news is announced, you can have spontaneous violence in every major city and even minor cities throughout the United States. That is highly likely, both by President Trump supporters who are mad and angry, and by people who hate President Trump, who are celebrating. Do you know what happens when a World Series victory is won in a major city like Chicago or Los Angeles? There is rioting. There's celebration, but it becomes violent. That happens, and police are deployed every time there's a World Series game and the city is about to win, because they anticipate violent celebration of revelers who are happy that their team won. So when President Trump dies, if he dies, you're going to have massive celebration by those who hate President Trump. And we know a lot of the people in the liberal media hate Trump, but just by hearing people at your work, your co-workers and your friends, how much some people hate President Trump. So they're hoping that President Trump dies, some of these people. And when President Trump dies, if he dies, they will celebrate. And maybe some of your friends will not be rioting, but some will. Some of your coworkers may not go violent, but some of you, they will when they celebrate. Whenever there's a major event, like a World Series victory, police are always deployed because anything can happen. And you have to understand this in those terms. When President Trump dies, if he dies, you're going to have violence in every city. Violence, massive violence. And that's going to translate into looting of every major store. And obviously, there are opportunist criminals who will seize that opportunity to steal and rob. And some of them will rob using a gun or a knife or other lethal weapon. There will be people breaking into some homes if this rioting celebration continues for days. So people may invade your home, especially if you live in a city, like in New York City or Chicago or Los Angeles. There can be home invasions, so you probably want to get a firearm to protect yourself in case that happens. Because after defund police, they're not going to be able to protect you if you live in any major city like Atlanta, Georgia, Miami, Florida, Chicago, New York, Boston, Philadelphia, Washington, D.C., Charlotte, North Carolina, Charleston, South Carolina. They're not going to be able to protect you. So you need to get gun and training. If you don't have a gun and you have children and wife at home, they could be raped by criminals who break into your home if you're there. You need to get a gun legally with a license, obviously, to protect yourself and your children. I recommend you getting 3 different guns, a semi-automatic handgun like Glock. Obviously, make sure what's legal in your state and your location. And secondly, to get a shotgun, because shotgun you could just shoot in one direction and get the perpetrator, and teach your children to fire it. If they need to use it, they need to use it, right? Obviously, lock your gun away, but if 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 you die and your wife dies and your children are there and they can use a shotgun to protect themselves, they should. So you should give them training. And obviously, check the laws of your state and your location. Um, and you should get a semi-automatic rifle, because in the event that like a gang enters your home, middle of the night, or even during the day. So obviously, federal agencies need to prepare for that. So I recommend that every U.S. Marshal and every National Guard, Army National Guard, every state National Guard go on red alert now until, you need to go on red alert, because it can happen. Like President Trump could die now, today, later today. You just don't know when he's going to die. He has COVID, he has mild symptoms, he could degenerate, he could die within minutes or hours from complications. So you need to all go on a red alert now, every state, every city, every police department, and obviously these are not federal agencies, every police department, and this is my recommendation too, must prepare for attack of your police department. There are people who are in the defund police movement, some in Black Lives Matter movement, who hate the police, may participate. They may not initiate it, but they may participate in burning police cars. But because they had George Floyd protests where they're burning police cars, there's highly likelihood the next wave of anti-police protests will become violent, with people actually invading police offices and killing police officers inside the police station. Or they could throw dynamite into your police office building, through a window or through a front door, and use an explosive to kill a lot of police officers. Or, any kind of homemade explosive, improvised explosive device, IED. And there are online tutorials on how to build this improvised explosive devices using household items. So every police department in the United States of America should worry that could happen, because there's defund police everywhere. It's a movement. And there's Antifa everywhere. So I would encourage Arlington County Police Department, Fairfax County Police Department, Alexandria City Police Department, and Falls Church City Police Department to go red alert, put additional security measures like ready access to shotguns and semi-automatic rifles, and also reinforcing the entryway in case they throw an improvised explosive device, or some people may have access to dynamite they could throw inside the police department. So you need to create barriers to the front door, because if you just have people checking for COVID-19 through, those temperature guns at the front gate, they can make it there and throw the dynamite inside the building. So windows need to be safeguarded. If it's glass window, you could throw dynamite in, break the glass. So you need to prepare for that. Obviously, if it doesn't happen, great. But if you're not prepared, and if it does happen, then there's a problem. Police officers should expect to be attacked in broad daylight by defund police and those who hate the police once President Trump dies. That may be the way some defund police people will celebrate President Trump's death, because defund police hate President Trump with a passion. So do a lot of people in liberal media. If you're a police officer, you should always wear a vest and every protection you can. And you have to be extra careful, because you may not know that President Trump has died when the news is announced, but other people may know, and they may spontaneously go and shoot you at a Dunkin' Donuts, you know? Um, you have to expect everything. So I would encourage all the police officers at local, state, and local state levels um, to be on extra guard and reinforce your police stations and prepare for potential warfare. Um, what happened in Oregon can happen in every state, in every city. And President Trump is a strong man, but if he's dead, other Republicans may be kind of wussy, and you're not going to have the ready aid that you need. Like, if Joe Biden were president, he would do nothing, to protect the police. Um, so police officers must be on guard. You have to be in ready alert. And I know Arlington County is mostly Democrat, so is Fairfax County, Alexandria City government, Falls Church City government, but you don't want massive death in your city or your county. So you need to prepare for this. It will be your residents who will be attacking the police and killing them. Your residents in Arlington County, your residents in Alexandria City, Falls Church City, and Fairfax County. Some people hate the police. They're going to celebrate that way. There are criminals in every Virginia's 8th district area. So you need to prepare because that could be coming. So that's my second advice. My third advice is you need to hunker down and stay in your home. Don't move around too much. It's not time to move around. Number one, because COVID-19 is spreading and it's spreading through airborne. So every time you're inside a building, even with a mask on, if there is somebody with COVID-19, and if that person is spreading COVID-19, could be suspended in air. I mean, obviously, 100% of the people inside your building may not have COVID-19, and you may be sick. But even if one person has COVID-19, the whole room is not safe. And that's why you can avoid any kind of indoor situations if you can help it. You need to do that for yourself and your children because we're heading into 6 months of flu season. And COVID-19 is airborne. They're scientifically proven. You don't need a college degree to understand what it means to be scientifically proven. So you stay away from indoor areas, all indoor areas. Doesn't matter which indoor area. Obviously, I encourage you to go to church, to worship God. But as I said, minimum 20% of all those who go to church will get infected. That's a guarantee. Yeah, but I mean, you should still go, but 20% of you will get infected. Yeah. I'm Heerak Christian Kim, independent candidate for U.S. Congress of Virginia's 8th District. I'm predicting that minimum 3 million will die in COVID-19 America during 6 months of flu season, but more like 20 million. I'm predicting that 100 million people will die in the world. And since about 20% of the deaths are in America, that's why we had 20 million that can die. So President Trump has COVID. Now what? Well, the country needs to prepare for potential death, especially federal agencies, local agencies, state agencies must prepare. Because there's going to be massive violence in every city, every town in the United States of America. You saw what George Floyd protest was like. Now, look at how that's going to be 100 times worse. That's what you're looking at right now. History is history. Human nature is human nature. There are certain things you can expect. Both President Trump and Melania Trump, Mrs. Trump, has COVID. Obviously, both can die, but President Trump is significantly older, so he has higher chance of dying. Joe Biden can get COVID and die. I'm predicting that they will get COVID before the election. Just because they're moving around a lot, they're seeing a lot of people, even with a mask on, because it's airborne. Even if one person has COVID-19, they can still get COVID with mask on, because COVID-19 is airborne. Masks do not protect you against airborne. It just protects you against, well, surgical masks. You know, the surgical masks with three-tier protection. They protect you against droplet, not cloth masks. Cloth masks doesn't really, I mean, they protect you maybe 30% less, maybe. So it protects you a little bit, but not. So if you're in a room full of people who don't have COVID, you're safe. But you don't know who has and who doesn't. That's the problem here. Even if one person has COVID, you could be spreading COVID around. If you go to the area where he was and his particles are floating around, you can get it, even with a mask on. That's why I'm fairly sure Joe Biden will get COVID, and obviously Joe Biden will get it because she's his wife. You know, husband and wife get it together, like, Virginia Governor Northam and Mrs. Northam got it just by visiting Prince William County Public Schools, which is open. And President Trump and Melania Trump got it. Maybe one of them visited a public school that was open. That's the easiest way to get it. Like go to like a school that's open. If one kid has it, you get it. And as you know, the debate is coming between Vice President Pence and Kamala Harris, who wants to be vice president, and that's next week, October 7th. So obviously, they should continue the debate because the election is on November 3rd. They may have to postpone the election, so that's a possibility that can happen. Especially if President Trump dies before election, which is, there's a high possibility of that because election is like a month away, 30 days away. A lot can happen in 30 days. You know, what if President Trump goes into hospital? What if President Trump goes into ICU, even if he didn't die? You can't have an election. So you should expect the election to be postponed maybe 6 months or even a year. I think that is becoming more and more likely. Obviously, Nancy Pelosi needs to discuss it with her House of Representative members, and Mitch McConnell needs to discuss this potential with U.S. senators. They need to discuss now, because what if President Trump dies tomorrow? I mean, are they going to flounder? You need to do your job, Mitch McConnell and Nancy Pelosi. You need to discuss the details of what you're going to do if X, Y, and Z happens. If President Trump goes to hospital, are you still going to have election? If President Trump goes into ICU, intensive care unit at a hospital, are you still going to have election? If President Trump dies before election, are you still going to have election? You have to have measures in place. You can't just like, la-di-da. You know, the destiny of 330 million Americans are at a crossroads. Anything can happen. Anything. And obviously, Mitch McConnell and Nancy Pelosi and every U.S. House of Representative member and U.S. Senator must recognize the potential there's going to be nationwide ubiquitous violence that's going to be in every city and every town. You must recognize this reality that is possible. So it's not just about one man dying. You're talking about a lot of things happening, ripple effects of that. Massive violence. What are you going to do if there are nationwide violence and there are thousands of people getting killed through these violence every day? What are you going to do? Senator McConnell, what are you going to do? U.S. Representative Pelosi, what are you going to do? Do you have a game plan? I bet you don't. Because the fact that senators and House of Representatives do not have a game plan is why we're here. Right? They like to blame President Trump, but hey, U.S. government is made up of 3 branches, and you can't just blame one person, because every one of you are part of the federal government. And the fact that you don't have a game plan in place right now for the election, in light of President Trump having COVID, shows that you're not doing your job, senators and House of Representative members. It's a serious problem in America that you have become really lazy in COVID-19 America. Because you need to be leading, you need to be giving American citizens their stimulus checks. American economy is collapsing, and you're not doing what you're supposed to do. And that includes putting in measures in case President Trump goes to the hospital or goes to intensive care unit or dies. You need to put measures and game plan into place. What are you doing, Homeland Security? Do you have a plan? Do you know what you're going to do? What are you doing, FBI? What are you doing, Homeland Security? Do you have a game plan? I bet you don't have a game plan. That's why we're in the mess we're in. What do you think? COVID-19 is proliferating everywhere in America. We ran out of PPE because you don't have a game plan. And that's a problem. That's why I'm running for U.S. Congress, to save America from incompetence that's proliferating everywhere, leading to 1,000 Americans dying every day. You know, there aren't that many countries where 1,000 people are dying every day. India, Brazil, United States. And you have to blame these federal agencies for this, because they're the ones who are supposed to prevent this from happening. You can't blame President Trump. I mean, what is he going to do? He's going to do, like, take care of everything, every detail. You have bureaucracies to take care of detail. So the failure of COVID-19 is not President Trump's failure, really. It's the failure of Homeland Security. It's the failure of FBI, Federal Bureau of Investigations. And we also X-Files. We know what kind of work FBI is supposed to do. And Department of Homeland Security. You failed us, and you're about to fail us again. This is a serious problem. And that's why you need to vote for me, Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District, because our nation is quickly headed toward collapse. Now let's look at the figures. I have 7-month comparison. Obviously, we have 6 months. This is a 6-month anniversary, but we started on April 2nd, so we have data from there. On April 2nd, when I first started this show, there were only 5,911 deaths in the whole nation. 5,000. By May 2nd, we have 66,365. Because about 30,000 people died in New York in about a month period. That's why. You see, 1 month. That's why I'm saying New York will have over 1 million people die, because April is like a tail end of flu season, and New York City and New York State had like what? Mostly focused on New York City, had like 30,000 deaths. 6 months long flu season, you're gonna have 30,000 times 6, 180,000. But obviously, it's not going to be constant. It's going to grow exponentially because hospitals will run out. And in 1 month of COVID-19 in New York, hospitals ran out of everything. So imagine 6 months of it. That's why I'm saying minimum 1 million will die in New York State. It's guaranteed. It's 100% certain that at least 1 million people will die in New York State. Look at the numbers. I'm just presenting the numbers here. June 2nd, you had 106,180 people dying, because you had several other states, right? And that was mostly in the 1 month period. You know, I trickled in, but it was like 1 month of concentrated deaths. But the death did not go away because we had again spike in June. So you see the death continued. July 2nd, we had 128,684 deaths. And the deaths keep continuing in the summer. We had what, 25,000 more deaths or more in 1 month period. In August 2nd, we had 154,841 deaths. 1 month later, we're still having over 20,000 deaths in a month. September 2nd, we recorded 185,704 deaths. 1 month later, we had over 20,000 deaths again. Again. October 2nd, that's today, 207,867 deaths. This is where we are as a country. Because federal agencies failed us. Homeland Security, National Security Council, Federal Bureau of Investigations, you failed us. And I blame President Obama, 8 years of Obama and Biden for that. Because during the 8 years, Federal Bureau of Investigation degenerated. Other federal agencies degenerated. I blame Obama. Obama created a problem around the world. The world was destabilized under Obama. Obama is 100% incompetent as a president. because he failed in foreign policy, foreign diplomacy. Like there are wars everywhere, and peace was gone. This is the legacy of Obama. And domestically, we had our greatest economic collapse during presidential period of President Obama, and he kept blaming the previous administration. The buck must stop with you when you're president. You know, you don't keep blaming the past president. Like, you know, you hire a new CEO for your company, and if he keeps saying, "Oh, it was a previous CEO," do you think that jives with the board of directors? No. It's what happens in your watch that's important. President Obama was an incompetent president, probably the most incompetent president we had in the history of the United States of America. We had so many horrible things happen under President Obama and Vice President Biden. It's not even funny. And you're going to vote for Biden to continue what? 4 more years of that tragedy? You want another like economic collapse? Yeah, I mean, that makes a lot of sense. Cases in America on April 2nd, we had 244,678 cases. May 2nd, you see that kind of starting to grow exponentially. 1,127,712 cases. You start to kind of look like it might decrease. You know, heading into summer, like China has 0 deaths in 4 months of summer. So June 2nd, we have 1,831,730 cases. 1 month later, we had like 1 million cases because you start having a spike. And the second wave went from June to August, 2-month period. So on July 2nd, we have 2,735,339 cases. 1 month later, in August 2nd, look at this. We have 2 million cases. It's growing exponentially. 4,665,932. 1 month later, we have like a peak down because third peak is starting in September. As I said months ago, third peak is from September to December. So, you know, you went down a little bit towards September. So you have less than 2 million cases. So on September 2nd, you have 6,113,160 cases. And now it's beginning to rise. So you went down and it's now beginning to rise because there was a downward peak after August and the new peak started in September. So you see a little, you know, little dip there in September. And so we're in October, we have, so the dip starts to increase again, right? 7,282,027 cases. The world had 52,972 cases on April 2nd, mostly from China death, right? China death and Italian death and Spanish death. And now Italy and Spain are spiking again. And then England started to have massive death, and you see sharp growth in death rate in the world. 1 month later, 243,355 deaths. And then it kind of, you know, it still keeps growing. On June 2nd, 380,180 deaths. And it's continuing to grow. So you have, on July 2nd, 519,575 deaths. In August, I mean, you see constant growing of death. 687,930 deaths. And you have on September 2nd, 861,512 deaths. And it's constantly growing. In October 2nd, we have 1,024,426 deaths. And you can see that cases are growing exponentially. So this is a 365 days a year. There's no stop of the virus. It's not like a Spanish flu pandemic of 1918 when, you know, in the summertime, it was like basically all gone, like no deaths. It's not like that here. It's continuous death rate going up, infections going up. So it's a 365 days a year virus like HIV virus or hepatitis C virus, herpes virus. You can get it any time of the year, 365 days a year. And that's why it's forever. It's not going to end. Because it's not a season of flu that it goes away and come back again, and sometimes it goes away, it doesn't come back. But it's not like that. This is like continuous infection. It's continuously maintained from people to people, infection. It's not going to go away ever. Yes, that's what healthcare experts are saying. What do you think 365 days a year is? There's only 365 days in a year. It's not going to go away. There's no vacation. World cases on April 2nd were at 1,014,673. It went up over 2 million cases. 1 month later, on May 2nd, you had 3,421,834 cases. And it went up like by 3 million. So you see it's exponentially growing. June 2nd, you had 6,376,822. 1 month later, yeah, it's exponentially growing. It's definitely clear. So July 2nd, you have 10,835,092, right? And then it's exponentially growing throughout the summer. That's the main point. It's not a seasonal virus. It's a 365 days a year. Its exponential growth rate is not deterred. It continues, right? Globally. So you have August 2nd, you have 18,002,567 cases. And it grows exponentially again. September 2nd, 25,934,466 cases. And it went up over 11 million cases in 1 month from September 2nd to October 2nd. 34,374,469 cases. And we're entering 6 months of flu season, 6 months. I put some photos of bikini-clad, beautiful women because you're not going to really see that ever again for decades to come. Yeah, so take a good look. And next to the beautiful the bikini-clad women, you see women in masks. That's what you're going to see from now, forever. Yeah. Will COVID-19 usher in 6 months of hell in USA in flu season? What do you think the answer is to that? Yes. Yes. It's unfortunate, right? I don't believe in the fake news that make it sound like flu. It's like a little flu virus that's going to go away. It's not a flu virus. Liberal media is lying to you. CNN is lying to you when they say there's 95% chance that President Trump will survive. CNN is lying. Either they're lying or they're ignorant. Yeah. As you know, I'm Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. Write in my name on the ballot, Heerak Christian Kim, because as you know, and I've told you in other earlier shows, this is a daily show, that I filed a lawsuit in Arlington Circuit Court against Virginia Governor Northam and Virginia Department of Election to put my name on the ballot without the 1,000 signature of petitioners, because I went independent in March and Virginia Governor Northam shut down the state from March 30th to June 10th. And I had to submit 1,000 signatures of petitioners, 1,000 signatures from Virginia's 8th District by June 9th. It was illegal for me to go door to door to collect signatures. Or my volunteers, I have like dozens of volunteers. They couldn't collect the signatures because it was illegal to do that. So I wrote to Commissioner Chip Piper or Virginia Board of Department of Elections, and Chip Piper is the commissioner. He wrote back saying he doesn't have legal authority to give me a waiver. So I wrote to Governor Northam, and he still hasn't written me back yet. I mean, now that he's in quarantine with COVID-19, he has time. He should write back to me. But I filed a lawsuit on June 3rd because I needed to file a lawsuit before the deadline, right, for everything to be legit. So I filed a lawsuit on June 3rd. But because of COVID-19, the process is taking really slow. So I should have had my name on the ballot by now because court will give me my my request because that's the fair thing to do. But because court is really slow, judges are working from home, lawyers are working from home, most everybody's working from home. So that's why it's kind of stuck in the court system. So it should be on the ballot by November 3rd if there is an election. So you can vote for me when you go to the ballot box on November 3rd if ballot boxes are open then. But if you're voting early, then just write my name in, Heerak Christian Kim. Yeah, you could do that with absentee ballot as well. Make sure you spell my name right. So double check my name. Yeah. But what will the 6 months of hell in USA and flu season look like? First of all, the election may be postponed for 6 months or a year. Because, we understand from May that May may be like a low time. So election may be like around Memorial Day. They may postpone it from November 3rd to like, the week before Memorial Day. Because we know from our experience that's the low season. It's lower than other times where you could actually kind of go in and vote with social distancing. So there's high probability U.S. Congress and U.S. Senate will postpone election from November 3rd to like May 20th, whatever the Tuesday is. There's high likelihood of that. Congress or the Senate can also declare state of emergency, or I'm not sure if they have that power to do that, but President Trump, he may be dead. Executive branch generally declares state of emergency, right? But there must be some provision in there, but there may not be because we never had a situation like this. Yeah, so I guess another way to go is postpone the election or cancel the election altogether, which could happen. Or postpone it 1 year, but I wouldn't recommend postponing a year because next November you're gonna have the same problem. You're gonna have millions of Americans dying from the flu, COVID-19 and the flu season. So this problem is not going to end. It's going to continue forever. And don't expect the vaccine in the next 10 years. You're not going to have a working vaccine. They have not even identified all the strains of COVID-19. How are they going to develop a vaccine without having identified all the strains? How are they going to do that? You're going to get COVID even with a vaccine. Dr. Fauci said as much. He said vaccine will not protect you 100%. What good is a vaccine that doesn't protect you 100%? It's like having no vaccine. And that's the academic consensus. What Dr. Fauci said is what all the healthcare experts believe, based on science. Yeah, environmental science, biology, science, chemistry. Is global warming real? Is COVID-19 real? Yeah, these are questions that you could reject the science. Yeah. Global warming isn't real. COVID-19 isn't real. You can say what you want. Doesn't change the fact, right? COVID-19 is very real. So Dr. Fauci has that mask on. He knows if with airborne protection, that's not going to protect him from COVID-19. He knows that. Your child could be in intensive care unit like that. And you won't be able to see your child. You know how it was last season. You're not going to see your child before your child dies. So you're going to look like a lot of you in Fairfax County. You're going to be experiencing this because Fairfax County Public Schools is opening up. You're going to have your children die. You deserve it if you send your child to school. You're the one who sentenced your child to death by sending your child to a school when COVID-19 is airborne. Science supports that COVID-19 is airborne. If you have a college degree and you still send your child to a classroom, geez, you're guilty as hell. You should know better after taking the biology classes in high school and in college. Well, they say, first responders are heroes, nurses are heroes, but these are the people who are going to die in massive numbers. I'm predicting that minimum 10,000 nurses will die before Christmas 2020 because COVID-19 is airborne. If one person patient has it and is spreading it, the regular surgical mask, surgical mask is this kind of mask. You see, this is surgical mask. It's the mask that you wear in the hospital. If you have this surgical, there's like 3-tier protection. This could protect you against droplet, but not against airborne, because it could go inside any open space, anywhere it's open, it could go inside. So if it's airborne, so if you like knock it off, like you're wearing it and you like accidentally knock it off, in intensive care unit as a nurse, you get it. So a lot of people are going to get it, especially a lot of nurses in intensive care units and emergency room are going to die or get COVID, and maybe some will die from COVID. I'm predicting that 10,000 nurses will die by Christmas. I'm not trying to get you mad. I'm trying to give a public health announcement so people are aware of what's going on. And obviously, healthcare workers need to know, staff members, frontline workers need to know. So this is a healthcare service. I'm a clinical nurse leader. I'm certified nationally as a clinical nurse leader. This is part of my obligation and duty as a clinical nurse leader to provide education in time of public health crisis. And that's within our responsibilities to do evidence-based research and share the evidence-based research to improve healthcare delivery at the unit level. Yeah. What do you think we do? Why do you think we worked hard for 2 years to get a master's in clinical nurse leader, take the certification exam, get certified, if we're not going to use that to better healthcare, to provide healthcare, public health services to U.S. citizens and U.S. residents and people who are here, right? What's the point of getting your degree if you're not going to use it to save lives? So here I am using my expertise within my scope of practice to provide information you need. I'm a clinical nurse leader, CNL. This is within my scope of practice. Yeah, and there are people who don't want you to know the truth, like liberal media, right? They think it's like fake news. And there are these crazy nuts in healthcare system as well. Yeah, there are crazy nuts in healthcare system that want you to know, that want to hide the truth from you. But truth is out there. The truth is out there. And I'm going to make sure you get it. This is a public health service. You need the truth to survive COVID-19. Why do you think there are 1,000 people dying every day in the United States? Because they're trying to suppress the truth from you, the liberal media. That's why you need to vote for me, Heerak Christian Kim, independent candidate for U.S. Congress in Virginia's 8th District. Because I will not let them suppress the truth. I will not let them hide the truth from you. I will tell you the truth against all the enemies of truth who want you to be in the dark ages. In the dark ages, they don't want you to have the truth, right? Earth is flat. No, it's not flat. It's round. The truth is out there. I'm going to make sure you get the truth. Yeah, Netanyahu shut down the whole country of Israel. It's the first country to do that. I respect Netanyahu for having the courage to do that. Obviously, it's the Jewish state of Israel. Majority of the population is Jewish. And he cares about Jews because he's Jewish and it's a Jewish state. If Jews die in large numbers in Israel, the Jewish state gets destroyed, right? Logically, you need people in your Jewish state for it to be a Jewish state. If they die from COVID, you don't have a Jewish state anymore. Yeah, because 100% of Israeli population serving the U.S. military to protect the country. This country is small. They have a lot of enemies. You have a lot of them dying. You won't have the soldiers to protect your country. So it's not just about like having citizens. You need soldiers to protect your country. And soldiers come from your population. It's a small country with a lot of enemies. Your children there, they're going to die because COVID-19 is airborne. So if one of those children have COVID-19 and they play around with their mask, release COVID-19, none of those masks are N95, they're going to get COVID-19 and die. Yeah, I mean, not all of them will die, but they're going to get COVID-19, most of them. Some may luck out, but most won't. That teacher looks like he's going to die. He looks overweight. A lot of teachers in Fairfax County will die. You will die if you teach inside a classroom. There's a high chance you will die. So write out your will. If you want to die, go and teach inside a classroom. That's what I would say. But if you don't want to die, don't teach in a classroom. You gotta decide what you want out of life. Some people like to risk death. Hey, if you like to risk death, go right ahead, teach in a classroom. Because yeah, you will definitely be risking death. Every teacher who's teaching in person in classroom, you're risking death. 20-year-olds can die from COVID-19. That's 100% certain from science. But there's evidence-based research, proof that you can die from COVID-19 if you're a 20-year-old healthy teacher. Yes, you can die. And I'm going to provide the truth because I'm a clinical nurse leader certified nationally. And I'm not going to lie to you. I'm not going to keep the truth from you like liberal media, like CNN, which try to say things are going to get better. It's not going to get better. It's only going to get worse. We're only starting out. So look at how America will be in 2030. 10 years from now, you should expect at least 50 million Americans to have died by then. At least. At least. What do you think cancer does? Cancer is a good example for what kind of death rate you're looking at 10 years from now from COVID. Has cancer gone away? No. Every year, 1.6 million people get cancer or more, sometimes 2 million. Out of that, over 60% die within 2 years. That's a guarantee. You can get all the treatments you want, chemotherapy, you can get all the surgeries you want. Over 60% of 1.6 million Americans who get cancer, this is just in America, will die within 2 years with using all the measures. That's every year. So let's say 1 million people die from cancer every year. Over 10 years, you're going to have 10 million people die. You see how that works? COVID-19 is the same. It's not going to go away. There's not going to be an effective virus for the next 10 years, minimum. There's not going to be a cure for the next 10 years. People are going to keep dying at the same rate or a higher rate. And I would say higher rate is exponentially growing. There are 330 million Americans. All 330 million Americans can get COVID, and you can get it again and again and again. As Dr. Fauci said, antibodies do not protect you for life. It's temporary. It could be for weeks. It could be for days. It could be for months. And it's different for individuals based on their DNA, genetics, health history, their condition, pre-existing condition, whether they're fat or thin. So it's not the same for everybody. But one thing is certain, it doesn't protect you from another COVID infection. And there are so many different strains. Yeah, I mean, you can get infected with one strain, and there's so many strains. What are other things that can happen? You have Chinese aspiration for global domination, which is becoming more and more real every day. Because China doesn't have people dying from COVID. North Korea doesn't have people dying from COVID. As you know, it's my theory that China created COVID-19 in a lab as a biological weapon and released it, targeting NATO and U.S. allies, NATO and United States. But you can't control a biological weapon like you control a nuclear weapon, which is next to the North Korean leader and the Chinese leader. Because missiles you could control, but viruses you can't control. They have it is a live virus, right? You could mutate it and use it as a weapon, but you can't control every virus. They mutate. They're living organisms. It's like if you have an elephant as your weapon, like some armies in the ancient world use elephants. Sometimes elephants they have a stomach ache or whatever, and they start stepping on your own soldiers. They're trying to step on enemy soldiers, but you can't prevent them from stepping on your own soldiers because they're animals. Even with all the training, if they, certain things can trigger certain things. And so they're alive, just like viruses. Yes, it's weaponized by China, and they try to control it as best they can. But you can't control a living organism 100%. So, China may live to regret it for creating this biological weapon, because it could circle around and hunt them too, with like multiple mutations over 10-year period, and they probably have an antidote, but yeah, but that antidote probably will not work after a lot of mutations, so I mean that's one possibility, it's always possible. Um, you have the North Korean and Chinese army about to invade America. As you know, I believe that they will invade America after millions of Americans have died, that they have a systematic plan, game plan for global domination, which includes colonizing the United States and taking natural resources from the United States to strengthen their own nations, China and North Korea. So that's what that's my theory. Let's see if it's true. Well, nobody's dying in North Korea from COVID. Nobody's dying from COVID in China. So their economy is 100% operational now. Every factory is open. Every company is open. Every school's open. Nobody's dying there. Yeah, we're the ones suffering. We have 1,000 people dying. Nobody's dying in China and North Korea. And they're like brothers. They're like blood brothers. So they share everything. Yeah. So yeah, I hate to break it to you at the 6th-month anniversary of this show, COVID-19 Update by Heerak, which is a daily show created by Heerak Christian Kim, independent candidate for U.S. Congress, Virginia's 8th district. That's who I am. But next 6 months is going to be hell. And I'm predicting that minimum 3 million Americans will die during the flu season, but more like 20 million Americans will die by next April. I'll do like an anniversary show every month so you can follow the figures. But, if President Trump and his wife can get COVID, you can get COVID. There is not a single person in America who will not be, who can protect themselves from COVID. Because can you imagine the measures that U.S. intelligence deploys to protect President Trump? The latest technologies, latest healthcare strategies, the greatest experts in every field, and still President Trump and his wife Melania Trump got COVID. You're going to get COVID. You should expect it. If you don't get it, well, you've kind of quote lucked out, or God spared you. But you're going to get COVID. You should expect it. Obviously, it's better for America if all 330 million Americans get COVID this season, and then we have herd immunity, and we're kind of protected. But the problem is that's not happening. At the current rate of infection, this thing can last for 20, 30 years easy. Easy. And we got to remember, every year people are born. And so they're new people. Like someone who's born now, 10 years from now will be 10 years old. So it's not like the same people are existing, same 330 million people are existing. So slow rate of infection, I mean, you think that the rate of infection is fast, but it's actually not that fast. At this rate of infection, this is going to be infecting people for a long time. And also it cycles around, right? I mean, you could get infected again. And virus is mutating. So what that means is expect COVID-19 to be forever. Because some viruses don't mutate that much. But this one is aggressively mutating. That's a serious problem. Because it's like having a new virus. Like 2 years from now, it's like a completely new virus. Or it resembles a new virus. It's a serious problem, and part of the reason maybe because it was created in a lab. It's unstable, right? It's like Frankenstein, highly unstable. It's a Frankenstein virus. But because I know a lot of nurses will die, unfortunately, doesn't Harry look sad? Harry looks really sad. But for some reason, Moose doesn't look that sad. He always has that smile on his face. I mean, come on, Moose. It's not time to have that smile. But Yeah. So because I know a lot of nurses will die, I'm predicting that at least 12 nurses will die in every hospital in this area. Fairfax Hospital will have at least 12 nurses die. Alexandria Hospital will have at least 12 nurses die from COVID-19. Virginia Hospital Center will have at least 12 nurses die from COVID-19. Georgetown University MedStar Hospital will have at least 12 nurses die from COVID-19. George Washington University Hospital will have at least 12 nurses die from COVID-19. Children's National Hospital will have at least 12 nurses die from COVID-19. And Sibley Hospital will have at least 12 nurses die from COVID-19 before Christmas, all before Christmas. That's like expected right now. Flu season is starting. Christmas is what, like whole month of October, whole month of November, and basically the whole month of December, 3 months. Of course you're gonna have 12 nurses die in every hospital. I mean, you should expect that. Yeah, 3 months of hell. And then you have 3 more months to go of hell. Yeah. Yeah, so I'm going to do a cheer for my political nurse leader members because, I'm predicting that like 5 out of 25 will die. There's like 20%, but maybe more by Christmas. Because some people are overweight, some people have pre-existing conditions like asthma or peanut allergy, they'll be the first ones to go. But maybe not as fast as people who work in ICU and emergency departments. They'll probably be the first ones to go. Because COVID-19 has mutated to infect young people. So if you're 20 years old, you're not safe anymore, like you were in March. So that's why, minimum 12 will die, every hospital. Yeah, so I want to do a cheer for my clinical nurse leader members at Georgetown University. 2 years, a very hard program. I mean, we learned a lot, and obviously, I'm happy to share all my expertise with you. I don't want to do it to waste. I mean, I borrowed $200,000. Over 30 years interest, it becomes like $500,000. I'm going to use my education to save your lives. That's why I have this show. Yeah. So I want to celebrate my fellow clinical nurse leaders in cohort 2020. We graduated on August 24, 2020. So CNL 2020, yay! We graduated on August 24, 2020. You may die before Christmas if you work in ICU or ED, emergency room, but you can at least put on your tombstone that you graduated from Georgetown University with a master's degree in clinical nurse leader on August 24, 2020. Yay! You did it! Yeah, you gotta celebrate achievements, but you're gonna have defeats in life, and some of your greatest defeat would be death by COVID before Christmas. Let's be real here. I don't believe in the fake news. They make it sound like COVID-19 is gonna go away. It's not gonna go away. Let's get that straight through your head. There's no scientific evidence to show it's gonna go away. And preponderance evidence shows that it's going to be here forever. I mean, give me evidence that says it's going to go away. Now email me, on my website, Heerak for Congress. Email me and let me know if you have proof that it's going to go away. It's not going to go away. So as you know, I'm an official candidate for U.S. Congress in Virginia's 8th District. And I encourage you to align yourself politically with me and my political positions. Your political affiliation is protected by civil rights laws of the United States of America. If somebody fires you from your job for agreeing with me politically, with all my political positions, you can sue them in the court of law. And also, they can go to jail for it, for violating civil rights law. So email me if you run into problems because you agree with me politically, because it violates federal law. They can go to prison for that. And we'll make sure we put them in prison. So I'm a Calvinist. What can I say? I like justice. They say Calvinists emphasize justice and law. And that's why President Trump's like, law and order, because he has a Calvinist streak in him. Because Scottish Presbyterianism is Calvinist. Anyway, Yeah. So is Augustinian. You know, they're Augustinian monks. They're all like Calvin. Calvin actually is Augustinian. He was an Augustinian monk. So is Martin Luther, was an Augustinian monk. So I mean, I guess I should call myself Augustinian, but you know, because Augustine existed over 1,000 years before Calvin, and Calvin basically copied his ideas. You know, so Catholic Church has a Augustinian strand, which is like Calvinism. Um, yeah. So you know, I hope that you will be well, and that your family will be well too. Um, yeah, so I look forward to seeing you tomorrow, and yeah, make sure to watch tomorrow's show. Things are getting worse and worse right now. You need to watch this show to save your life and your children's life from COVID-19. Okay, bye.